Abdominal thrust, a method of attempting to remove an object from the airway of someone who's choking. Abduction, moving a body part away from midline of the body. Abrasion, an injury that rubs off the surface of the skin. Absorption, the transfer of nutrients from the intestine to the cells. Abuse, purposeful mistreatment that causes physical, mental, or emotional pain or injury to someone. Activities of daily living, ADLS, daily personal care tasks such as bathing, dressing, caring for skin, nails, hair, and teeth, eating, drinking, walking, transferring, and elimination. Acute care, 24-hour skilled care given in hospitals and ambulatory surgical center for people who require short-term, immediate care for illnesses and injuries. Abduction, moving a body part toward the midline of the body. Adult day service, care for people who need some help during certain hours but who do not live in the facility where care is given. Advance directive, legal documents that allow people to choose what medical care they wish to have if they are unable to make those decisions themselves. Affect side, a side of the body that is weak ended due to a stroke or injury, also called the weaker or involved side. Agents, prejudice toward a stereotyping of and discrimination against older or person or the elderly. Alzheimer's disease, a progressive incurable disease that causes tingle nerve fibers and protein deposit to form in the brain, which eventually cause dementia. Ambulation, walking. Ambulatory, capable of walking. Amputation, the surgical removal of some or all of a part of amputation, the surgical removal of some or all part of the body, usually arm, leg, or foot. Angina, chest pain, pressure or discomfort. Anxiety, uneasiness, worry or fear, often about a situation or condition. Apathy, a lack of interest in activities. Aspiration, the elimination of food, fluid or foreign material into the lungs. Assault, a threat to harm a person, resulting in the person feeling fearful that he will be harmed. Assisted living, residence for people who do not need 24-hour skilled care but do require some help with daily care. Assistive device, special equipment that helps person who is ill or disabled to perform activities of daily living. Atrophy, the wasting in weight, decreasing in size, or weakening of most muscles from lack of use. Autoimmune illness, an illness in which the body immune system attacks normal tissues in the body. Battery, the intentional touching of a person without their concerns. BIAS, prejudice. Bipolar disorder, mental health disorder that causes a person to swim from periods of deep depression to periods of extremely activity. Manic episode. Blood-borne pathogens, microorganisms found in human blood, body fluid, draining wounds, mucous membranes that can cause infection and diseases in humans. Body mechanic, the way the part of the body work together when a person moves. Body prominences, areas of the body where the bone lies close to the skins. Brachial pulse, the pulse located inside the elbow, about 1 to 1.5 inches above the elbow. Cardiopulmonary resuscitation, CPR. Medical procedure used when a person's heart or lungs have stopped working. Care plan. A plan developed for each resident to achieve certain goals. It outlines the steps and tasks that the care team must perform. Catastrophic reaction. Reacting to something in a unreasonable, exaggerated way. Catheter. A thin tube inserted into the body to drain or inject fluids. Causative agent. A pathogenic microorganism that causes diseases. Centers for Disease Control and Prevention. A federal government agency that issues guidelines to protect the health of individuals and communities. Cerebrovascular accident, CVA. A condition that occurs when blood supply to a part of the brain is blocked or a blood vessels leaks or ruptures within the brain, also called stroke. Chain of command, the line of authority within the facility. Chain of infection, a way of describing how diseases is transmitted from one human being to another. Charting, documenting information and observations about residents. Chain strokes, alternative periods of slow, irregular breathing and rapid, shallow breathing, along with periods of non-breathing. Chronic, long-term or long-lasting. CITE, a long-term care facility. In a long-term care facility, CITE to document a problem through a survey. Clean is in healthcare a condition in which objects are not contaminated with pathogens. Clean cache a specimen, a urine specimen that does not include the first and last urine voided, also called mystery specimen. Cliches, phrases that are used over and over again and do not really mean anything. Closed bed, a bed completely made with the bedspread and blankets in place. Clostridioides difficile, a bacterium that is spread by spores in feces and difficult to kill. It causes symptoms such as diarrhea, nausea, and can lead to serious inflammation of the colon, colitis. Cognition, the ability to think logically and clearly. Cognitive, related to thinking and learning. Cognitive behavioral therapy, CBT, a type of psychotherapy that is often used to treat anxiety disorders and depressions and focus on the skills and solutions that a person can use to modify negative thinking and behavior patterns. Cognitive impairment, the loss of ability to think logically and clearly. Combative, violent or hostile. Combustions, the process of burning. Communication, the process of exchanging information with others by sending and receiving messages. Compassionate, being caring, concerned, considerate, empathetic, and understanding. Condom catheter, a type of urinary catheter that has an attachment at the end that fits onto the penis, also called Texas catheter. Confidentiality, the legal and ethical principle of keeping information private. Confusion, the inability to think logically and clearly. Conscientious, guided by a sense of right and wrong principle. Conscious, the state of being mentally alert and having awareness of surrounding sensations and thoughts. Constipation, the inability to eliminate stools or in the infrequent, difficult, and often painful elimination of hard, dry stool. Constrict, to narrow. Constrictor, the permanent and often painful shortening of a muscles or tendon, usually due to a lack of activity. COVID-19, a droplet, an airborne disease transmitted through droplets and particles produced by an infected person, often characterized by respiratory symptoms and capable of progressing to severe symptoms, even death, especially in people who are older, have underlying health conditions, or are unvaccinated. Cultural diversity. The different groups of people with varied backgrounds and experiences who live together in the world. Culture, a system of learning beliefs and behaviors that is practiced by a group of people and is often passed on from one generation to the next. Blue or gray, a reference to skin color. Cyanotic. Dangle, to sit up with the legs hanging over the side of the bed in order to regain balance and stabilize blood pressure. Dangle. Defenses mechanism. Unconscious behaviors used to release tension or cope with stress. Dehydration. A serious condition that results from inadequate fluid in the body. Delirium. A state of severe confusion that occurs suddenly and is usually temporary. Delusion, persistent false belief. Dementia, the serious loss of mental abilities such as thinking, remembering, reasoning, and communicating. Dentures, artificial teeth. Depression, a mental health disorder that causes pain, fatigue, apathy, sadness, irritability, anxiety, sleepiness, loss of appetite, and well as other symptoms also called major depressive disorder. Developmental disabilities, disabilities that are present and birth or emerge during childhood to age 22, that restrict physical and or mental abilities. Diabetes, a condition in which the pancreas produces no insulin, too little insulin, or do not properly use insulin. Diabetic ketoacidosis, a complication of diabetes that is caused by having too little insulin in the body. Diagnosed, medical condition determined by a doctor. Diastolic, the second measurement of blood pressure phase when the heart relaxes of rest. Digestion, the process of preparing food physically and chemically so that it can be absorbed into cells. Delayed, to within, direct contact, a way transmitting pathogens through touching the infected person or his secretion. Dirty, in healthcare, a condition in which objects have been contaminated with pathogens. Disinfection, a process that destroys most but not all pathogens. It reduces the pathogens count to a level that is considered no infections. Disorientation, confusion about person, place, or time. Disposable, only to be used once and discarded. Disposable razor, a type of razor that is discarded in a biohazard container after one use. Require the use of shaving cream or soap. Diuretics, medications that reduce fluid volume in the body. DOF, to remove. Domestic violence, physical, sexual, or emotional abuse by spouse, intimate partners, or family members. To put on, done. Do not resuscitate. The DNR, a medical order that instructs medical professionals to not perform cardiopulmonary resuscitation, CPR. Dorsiflexion, bending backward. Draw sheet, an extra sheet placed on top of the bottom sheet, used for moving resident in bed. Durable power of attorney for her care, a signed, dated, and witnessed legal document that appoints someone else to make medical decisions for a person in the event she becomes unable to do so. Dysphagia, difficulty swallowing. Dyspnea, difficult breathing. Edema, swelling caused by excess fluids in body tissues. Electric razor, elimination, the process of expelling wastes that are not absorbed into the cells. Elope, in medicine, when a person with Alzheimer's disease wanders away from a protected area and does not return. Embolism, an obstruction of blood vessels, usually by a blood clot. Emesis, the act of vomiting or ejecting stomach contents through the mouth and or nose. Emotional liability, an inappropriate or unprovoked emotional response including laughing, crying, or anger. Empathy, identifying with the feeling of others. Enema, a specific amount of water or without an or with or without an additive that is introduced into the colon. Ergonomics, the science of designing equipment, areas, and work tasks to make it safer and suit the worker's abilities. Ethic, the knowledge of right and wrong. Ethnicity, one aspect of a person's identity, often reflecting a combination of race, culture, language, nationality, and other factors. Expiration, the process of exhaling air out or the lungs. Expressive aphasia, trouble communicating through speech or writing. Extension, straightening a body part. The unlawful false imprisonment, the unlawful restraint of someone that affects person freedom of movement. Fecal incontinence. Financial abuse, the improper or illegal use of person money. First aid, emergency care given immediately to an injured person by the first people to respond to an emergency. Flammable, easily and capable of burning quickly. Flexion, bending a body part. Fluid balance, taking in eliminating equal amounts of fluid. Fluid overload, a condition that occurs when body cannot handle the amount of fluid consumed. Foot drop, a weakness of muscles in the feet and ankles that cause problems with the ability to flex the ankles and walk normally. Folders, semi-sitting positions in which a person had a shoulder are elevated 45 to 60 degrees. Folders, semi-sitting body position, 45 to 60 degrees. Fracture, a broken bone. Fracture pan, a bedpan that is flatter than regular bedpan. Full weight beating, a doctor order stating that the person has ability to support full body weight on both legs. FUB, gait, manner of walking. Gastrotomy, a surgical created opening into the stomach in order to insert a tooth. Generalized insider disorder, GAD, an insider disorder that is characterized by chronic insider and worry. Gestational diabetes, glands, organs that produce and secrete chemicals called hormones, glucose, natural sugars, gonad, sex gland, grief, the distress of sorrows over love, grief, when somebody died. Grooming, practice to care for oneself such as caring fingernails and hair. Hallucination, false of disordered sensory perception. Hand hygiene, washing hands with soap, water, and using alcohol-based hand rubs. HAT, in healthcare, a collection container that can be inserted into a toilet bowl to collect mixture urine or stool. Healthcare associated infection, HAI, an infection acquired within a healthcare setting during the delivery of medical care. Health Insurance Portability and Accountability Act, HIPAA, A federal law that requires health information to be kept private. Hemiparesis. Hemiparesis. Weakness on one side of the body. Hemiplegia. Paralysis on one side of the body. Hepatitis. Inflammation on the liver caused by virus or alcohol abuse. Some medications or trauma. Hoarding, collection and putting things away in guard way. Holistic care, a type of care that involves caring for the whole person. Home health care that improves a person's home. Homeostasis, the condition in which all of the body's systems are working at their best. Hormones, chemical substances created by the body that control numerous body functions. Hospice care, holistic, compassionate care given to people who have approximately 6 months or less to live. Hygiene, practice that keep bodies clean and healthy. Hypertension, high blood pressure regularly measuring 130 to 80 or higher. Impairment, a loss of functions or ability. Incident, an incident problem or unexpected event during the course of care that is not part of the normal routine in a healthcare facility. Incontinence, the inability to control the bladders or bowels. Indirect contact, a way of transmitting pathogens from touching an object contaminated by an infected person. Indwelling catheter, a type of urinary catheter that remains inside the bladder for a period of time, also called Foley catheter. Infection, the state resulting from pathogens invading the body and multiplying. Infection prevention, the set of methods practiced in healthcare facility to prevent and control the spread of diseases. Infection, contagious, inflammation, swelling. Informed consent, the process in which a person with the help of a doctor makes informed decisions about their hair care. Input, the fluid a person consumes, also called intake. Inspiration, the process of inhaling air into a lungs. Insulin, a hormone that works to move glucose from the blood and into the cells for energy or for the body. Insulin reaction, a complication of diabetes that can result from either too much insulin or little food. Intake, the fluid a person consumes, also called input. Intravenous therapy, the delivery of medication through a person's veins. Involuntary seclusion, the separation of person from others against the person's will. Involved side, a side of a body that is weakened or to the stroke of injury, also called weaker or affected side. Lateral, body position in which a person is lying or either side. Rules set by government. Legal state, the number of days a person stays in a healthcare facility. Liability, a legal term that means someone can be held responsible for harming someone else. Living will, a document that outlines the medical care a person wants or do not want in case she becomes unable to make those decisions. Localized infection, an infection that is limited to a specific location in the body and has local symptoms. Log rolling, moving a person as a unit without disturbing the alignment of the body. Long-term care, LTC, caregiving in long-term care facility for people who need 24-hour skilled care. Malpractice, injury to a person due to professionalism, misconduct through negligence or carelessness or lack or skill. Medicaid, medical assistance program for people who have low income, as well as people with disabilities. Medical asepsis, measures used to reduce and prevent the spread of pathogens. A federal health Medicare, a federal health insurance program for people who are 65 or older. Menopause, the end of menstruation occurs when a woman has not had menstruations for 12 months. Mental health, the normal functioning of emotional and intellectual abilities. Mental health disorder, a disorder that affects a person's ability to function and often causes inappropriate behavior. Metabolism, physical and chemical process by which substances are broken down or into energy. Microorganism, a living thing or organism that is so small that it can be seen only under microscope. Minimum data set, MDS, a detailed form with guidelines for assessing residents in long-term care facilities. Mode of transmission, how a pathogen travels. Modified diets, diets for people who have certain illness. MRSA, methicillin-resistant Staphylococcus aureus, bacteria that develop resistance to the antibiotic methicillin. Mucous membranes, the membrane that line body cavities to open like mouth, nose, rectum, genitals, eyes, ears, and so on. Myocardial infarction, MI, a condition that occurs when the heart muscles does not receive enough oxygen. Nasogastric tube, a feeding tube that is inserted into the nose and goes to the stomach. Neglect, the failure to provide needed care that results in physical, mental, or emotional harm to a person. Negligence, an action or failure to provide the proper care that results in intended injury to a person. Non-intact skin, skin that is broken. Non-verbal communication. Non-way beating, NUB, a doctor's order stating that a person is unable to touch the floor. NPO, abbreviation meaning nothing by mouth. Nutrient, a necessary substance that provides energy. Nutrition, how the body uses the food. Objective information, information based on what you see, hear, touch, smell. Obsessive compulsive disorder, OCD, is characterized by selfish behavior or thoughts which may cause the person to repeatedly perform behavior or routine. Obstructed airway, a condition in which something is blocking the top through which air enters the lungs, like when somebody can't now breathe. Occupational Safety and Health Administration, OSHA, a federal government agency that makes rules to protect workers from hazards or on the job. Occupied bed, a bed made with while a person is in the bed. Ombudsman, a legal advocate for residents in long-term facility who helps resolve disputes and settle conflict. Omnibus, budgets reconciliation at obra. Eso es para el training de las NA. Open bed, bed made with linen folded down on the foot to the bed. Opposition, touching the thumb to any other finger. Oral care. Orthotic device. Help support and align a limb. Osteoarthritis, common type of arthritis that usually affect the hips, knees, fingers. Osteoporosis, a disease that causes bones to become porous and causing them to break easily. Ostomy, surgical created opening from an area inside the body to outside. Outpatient care, caregiving to people who have had treatments, procedures, or surgeries and need short-term skill. Output, all fluid that is eliminated from the body. Oxygen therapy, the administration of oxygens. Pacing, walking, back and forth. Palliative care, caregiving to people who have serious diseases. Panic disorder, a disorder characterized by a person having regular panic attack. Paraplegia, a loss of function on lower part of the body. Parental nutrition, PN, the intravenous infusion of nutrients. Partial bath given on days when the person don't take a complete bath. Partial weight bearing. A doctor orders stating that a person is able to support somebody weight in one or both legs. Pathogens, microorganism. Pediculosis, an inspection of lice. Percutaneous endoscopy gastronomy, a feeding tube. Perineal care, to the genitals. Perineum, the genital and anal area. Perseveration, the repetition of words and phrases. Personal, relating to life outside one's job. Personal protective equipment, PPE. Person-centered care, a type of care that places the emphasis on the person needing care and their individuality. Pattern limb pain, a pain in a limb. Pattern sensation. Warm itching. Phobia, an intense irrational fear or anxiety about an object, place, or situation. Physical abuse, needs to relate processes and activity that keeps living things. Policies of physiological needs. Policies, a course of actions that should be taken every time a certain situations occurs. Portable commode, a chair with toilet. Polter entry, anybody opening on an unaffected person that allow pathogens to enter. Polter entry. Porter of earth seats, anybody opening on an infected person that allow pathogens to live. Positioning, the art of helping people into position. Post-mortem care. Post-traumatic stress disorder, a mental health disorder caused by experience. A traumatic experience. Posture, the way a person holds and positions his body. Prediabetes, a condition that occurs when a person's blood levels are above normal. Pressure injuries, injuries of wounds that result from skin deterioration. Pressure points, areas of the body that bear much of the body weight. Procedure, method of way of doing things. Professional, having to do with work or a job. Professionalism, the art of behaving properly. Pronation, turning downward. A body position in which a person. Prone is a body position if a person is lying on his side of stomach or front side of the body. Prone, acotado boca abajo. Prosthesis, a device that replaces body part, incident injury. Protected health information, PHI, a person health information. Psychological abuse, emotional harm caused by threatening, scaring, humiliating, intimidating, insulating, or psychological abuse. Psychological needs, needs that involve interaction, emotion. Psychotherapy, a method for treating mental health. Pure, to blend or green food into thick paste of baby food. Puree. Quadriplegia, loss of function of legs, deja de funcionar el cuerpo. Race, grouping of people based on physical characteristics. Radial pulse. Radial pulse es el que está cuando se va a tomar el pulso cerca de la mano, de los dedos. Range of motion, exercises, los ejercicios que se hacen para arriba y para abajo. Receptive aphasia, difficulty understanding spoken or writing words. Rehabilitation, care that is given by a specialist to help restore or improve function after an illness. Reproduce, to create a new human life. Reservoir, place where a pathogen lives and multiplies. Resident rights, numerous of rights identified in obra. that related to how residents must be treated while living in a facility. Respiration, the process of inhaling air into the lungs. Restorative care, caregiving after rehabilitation. Restraint, a physical or chemical way to restrict voluntary movement. Restraint alternative, restraint, measures used in place of restraint or that reduce the need for restraint. Restraint-free care, an environment in which restraints are not kept or used for any reason. Artritis reumatoide, tipo de artritis que donde los huesos se convierten rojos, se hinchan y da mucho dolor. Rotación, routine urine specimen. A urine specimen that can be collected anytime a person voids. Rummaging, going through drawers, closets, or personal items. Rummaging, safety razor. Scars, born scarred by head leakage. Schizophrenia, type of psychotic disorder that causes problems with thinking. Scope of practice, the range of tasks that healthcare providers are legally allowed to do. Sexual abuse, non-consensual sexual contact of any type. Sexual harassment, any unwelcome sexual advance. Sharps, neither needles or other sharp objects como aguja, cuchillo. Shearing, rubbing and friction that results from the skin moving one way, the bone under the neck in remaining fitted or moving into the opposite direction. Shearing. Shock, a condition that occurs when organs and tissues in the body do not receive adequate blood supply. Seams, a position in which a person is lying on his left side, which the upper knee flexed raised towards the chest. Skilled care, medically necessary care given by a skilled nurse. Social anxiety disorder, a disorder in which a person has anxiety about social situation. Special diets. A specimen, a sample that used for analyze order to try make a diagnosis. Sputum, catarro. A standard precaution. A sterilization. A cleaning measure that destroys all microorganisms. Stoma, an artificial opening in the body. A straight catheter, a catheter of urinary catheter that is removed immediately after urine. Stress, a state of being frightened, excited, confused. A stressor, something that can cause stress. Subacute care, care given in hospitals or in long-term care facility for people who need less care than for acute illness. Subjective information, information that person cannot observe. Substance abuse. Sundowning, becoming restless or agitated. Suspinant, turning upward. Supination, turning upward. Supine, a body position in which a person lies flat on his back. Surgical asepsis, the state of being completely free of all microorganisms. Susceptive host, an uninfected susceptive host, an uninfected person who could get sick. Sympathy, sharing in feelings and difficulties of others. Syncope, loss of consciousness, also called fainting. Systematic infection, an infection that travels through the bloodstream. Systolic, the first measuring of blood pressure phase when the heart is at work. Tactful, showing sensitive and having sense of what appropriate when dealing with others. Terminal illness diseases. Therapeutic diets. Transfer belt, a belt made of canvas to help people who are weak. Transmission, passage of transfer. Transient ischemic attack, a warning sign of a severe stroke resulting from temporary lack of oxygen to the brain. Transmission-based precaution, Method of infection prevention used when caring for people who are or may be infected with certain infections of diseases. Trauma informed care, an approach to patient care that recognizes that people may have experienced trauma, tuberculosis, TB, a highly contagious disease, tumor, a cluster and number of growing cells, unoccupied bed, a bed made while no person is in bed, urinary catheter, a type of catheter that is used to drain urine from the bladder, urinary incontinence, the inability to control the bladder, validating, or approving, giving value to or approving, verbal abuse, the use of spoken or writing words, pictures of gestures, verbal communication, vital signs, measurements, temperature, pulse, respiration, and blood, voids, urinates, BRE, vancomycin resistance, and enterococcus bacteria that have developed resistance to antibiotic vancomycin, wandering, walking around the facility, workplace violence, verbal, physical, or sexual abuse of staff by other staff members, workplace violence.